Moving on to the next topic, musculoskeletal. This is 6% of the exam. So looking at hip pain, there's a number of different differentials, starting with young people. The most obvious thing that could happen in an otherwise young and healthy patient with no risk factors is femoroacetabular impingement. This is when there's abnormal contact of the acetabulum and the proximal femur. And when you flex, this causes labrum damage, so that causes pain. Otherwise, they're healthy. Osteoarthritis is pain with internal hip rotation. You'll have a positive Thomas test. So the Thomas test is that you can't flex your leg to the chest without the other leg also having to move. Osteonecrosis is going to be slowly progressive leg pain, which is pain with weight bearing and swelling, and it's going to have a positive leg roll maneuver. The pain often is at the groin. Synovitis is a pediatric problem. They're ages 3 through 8, generally often after a upper respiratory infection. It's transient and the x-ray will be normal, but there may be fluid. Some nerve roots to remember in the leg, L3 and L4. So 3, 4 affect the patellar reflex, and then S1 is for the Achilles. L4 and 5 also innervate the great toe. Looking at the shorter pathologies, so if you do the Neer's test and that causes pain near to the ear, this is impingement, so a pinching. The Hawkins test is kind of waving the arm across the face. If that causes pain, that's also impingement. If you put your arm up, if you lift it up and then they can't hold it up there, probably means they've got a shoulder cuff, a rotator cuff tear. If you put their hand on the belly and tell them to press on their belly and that causes pain, that is the subscapularis. So sub, under the scapula muscle is probably torn. If you put their hand behind their back and they can't lift off their back, that is also subscapularis. Adduction external rotation test, so seeing if they can turn their wrist out like this. This tests the infraspinatus. And then Job test is to put the arms up and then kind of push down. So full can test, that's supraspinatus. Right. Some details with regards to fractures. So the Salter-Harris classification is how you classify different fractures. Well, I can't see it. So Salter, just remember S-A-L-T-E-R. So S stands for separated growth plates. So it's at the end of the bone and they just break. A is second class, which is above the growth plate, so into the main body of the bone. L is below, L for low, below growth plate, so just at the end of the bone. T is through the growth plate, so both above and below. And then ER is type 5, which is eraser of the growth plate, which just means you crush that bone down, so there's actually no gap there left. That's pretty serious. A Colles fracture is a wrist fracture where your wrist is extended and then you break out. A Smith's fracture is where you fall on the wrist and it's inwards and you break in. Some other tests. So Lockman is for the ACL integrity. McMurray's is meniscal tear of the knee. Homan's is pressing on the calf for DVT. Again, Job is supraspinatus. Speed's test is bicep tendonitis. Jurgensen's is biceps pathology. O'Brien's test is for labral tears. To treat low back pain, the first thing to do is increase exercise. The second thing is ibuprofen. And I think that's it for that.